Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Okay, today we're going to do a trick with just an ordinary deck of cards. You can borrow this from anybody, shuffle them up. It is simply a deck of cards. Okay, so I'm now going to take this deck of cards. We're going to let the volunteer take about half of the deck. And this is going to be a do as I do kind of deal. So what I'm going to do, I'll do mine first. I'll go through and I'll find any card in the deck. Well, pick the ace of spades. That makes it easy to remember. You're going to pick a card out of the deck too, and you're going to, you don't have to show me that. Actually, you'll keep it down, but it happens to be the three of spades. So now we have a three of spades and an ace of spades, and this is going to be the do it as I do thing. You're just going to hold your deck right there for a second. I'm going to put my card in your deck, and then we're going to put the other card, your three of spades, in the middle of my deck. So now what we've got is one card in here, one card in there, and I'm going to take half of your deck and just turn it upside down, place it on the top of mine, and the other half on the bottom. Now we've made a real mess of the thing. Somewhere in there are two cards, the one that I picked and the one you picked. So let's go through the deck real slowly and see if we can find those cards. There's yours. There's the three of spades. Happens to have flipped over on its own. There's the ace of spades. And we're halfway to a straight flush. Very simple trick. Let me show you how that's done. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. We've got a special guest here today. We're going to talk to Richard Golly about a brand new product that I know you guys are going to be real interested in hearing more about. He's representing Novalar, and it's Auraverse, which is a reversal agent for anesthetics. So I'm going to let you just talk about this for a few minutes and give us a little insight on what's going on.
Absolutely. It's a very nice concept to think of it. As you know, your patients who come to get their dental anesthesia remains numb for a few hours in general, anywhere between 1 to 3, 4 hours after the anesthesia is given and long after the procedure is completed. Patients do not like that numbness. They feel it impacts their day-to-day life, speaking, talking, maybe going to dinner, going to lectures. So we had the idea of developing a product that could reverse that, what we call soft tissue anesthesia. And we conducted a number of trials over the last 5 years and showed that this product actually can be very effective in reducing the duration where the lip, the tongue remain numb after anesthesia.
How quick does it work? Give us just a few little numbers so we get an idea.
Absolutely. In general, patients who had a local anesthetic with a vasoconstrictor remains numb on average for about 2 to 3 hours. Okay. What Auraverse does, it cuts down the time by about the half. Some patient can return to normal within 15-20 minutes. On average, about an hour. A few patients remain numb for about 2 hours. But on average, you can say it about half the time. It reduced the duration of anesthesia by about half the time.
I'm so sure there's not a dentist in the world that didn't yet somebody comes in and says, "Can you make this sensation go away?"
You can imagine it could be helpful for a professional that has to go back to their office to do the work, for someone who has to give a lecture. It could be someone who actually answer the phones in the customer department. It could be really anyone who actually feel uncomfortable with this numbness could benefit from this product. And because the dose that's given is very small, it's given into the same area where the local anesthetic is given, we do not see adverse event outside the injection site. So it's the same procedure that you'll give the local anesthetic, the same techniques, and there is no additional side effects with the product. And it has been in the market now for a few months, and both dentists and patients seems to like it. And we're very happy to actually have this product available. We would like to make the life of the patient more enjoyable, and that hopefully will get them to that point.
Now, if somebody wanted to get this product, how would they go about doing it? It's direct
It is currently directly purchased from Novalar. There is a customer number, an 800 number to call. It
we'll
can
put
be
that
on
on
the
the
website.
screen here.
Exactly,
so
and this is where you can get the acquired product, purchase it.
Well, I'm excited. I can't wait to play with it myself, and I appreciate you guys. You gave us a whole presentation this morning, and maybe at some point we can record that. That would be nice to share with our instructors. But Richard, it's a pleasure to meet you.
Thank you for giving us this opportunity.
Absolutely,
it's a
and
pleasure.
I'm hoping that we can really hear more and more about this product, because I think it's exciting, and I know it's going to be something that we're all going to want to know more about.
Thank you for your time.
Absolutely. Thank you. That didn't hurt.
No.
Well, that's it for another Root Tip of the Week. I'm Dr. Kent Weathers, inviting you to join me at our very next Root Camp. So long for now.